Hey everyone, welcome to a New Horizons HIPAA compliance training. Today, I'm breaking down everything you need to know about protecting client information. Not only is this a legal obligation, but it's also crucial for providing ethical and high-quality care. So, let's dive right in. First off, what exactly is HIPAA? HIPAA stands for the Health Insurance Portability and Accountability Act. This is a federal law designed to protect sensitive patient health information, or PHI, from being disclosed without the individual's consent or knowledge. Following HIPAA ensures the privacy, security, and integrity of health data. There are three key rules to be aware of: the privacy rule, the security rule, and the breach notification rule. The privacy rule governs how PHI can be used and disclosed. It covers all forms of PHI, written, electronic, or oral. The security rule sets guidelines to secure electronic PHI, or EPI, with administrative, technical, and physical safeguards. And the breach notification rule requires covered entities to notify affected individuals, the government, and sometimes the media if there's a PHI breach. PHI can include a lot of different things like names, addresses, phone numbers, social security numbers, medical records, diagnosis, treatment history, and health insurance information. Now let's talk about Virginia and DBHDS specific compliance. On top of federal HIPAA regulations, the Virginia Department of Behavioral Health and Developmental Services, or DBHDS, has its own guidelines. These are especially important for in-home and residential care providers. Some key DBHDS guidelines include handling all client information with dignity and respect, emphasizing person-centered support. PHI should only be shared with authorized individuals involved in treatment, billing, or healthcare operations. Records, both electronic and paper, need to be securely maintained and properly disposed of. And while confidentiality is crucial, you're also required to report instances of abuse, neglect, or threats of harm. So what are your responsibilities as an employee? First, maintain confidentiality in all interactions, both inside and outside of work. Only access PHI necessary to perform your job duties. Use secure communication channels like encrypted emails and password-protected files when discussing PHI. Never share passwords or leave PHI accessible to unauthorized individuals. Follow company policies for securing electronic devices, including logging off computers when not in use, and dispose of PHI securely by shredding documents or using secure deletion methods for electronic files. Let's quickly go over some common HIPAA violations to avoid. Don't discuss client details in public spaces or on social media. Don't leave medical records unattended or visible to unauthorized individuals. Never share login credentials with coworkers. Don't send PHI through unencrypted email. And avoid using personal devices to store or access PHI without authorization. If you suspect a HIPAA violation, report it immediately. You can contact your supervisor or compliance officer, the DBHDS Office of Licensing, or the U.S. Department of Health and Human Services if necessary. Remember, failure to comply with HIPAA regulations can result in disciplinary action, fines, or legal consequences for both you and the organization. To wrap things up, by following HIPAA guidelines and DBHDS regulations, we uphold our commitment to ethical and responsible care. Protecting client privacy is everyone's responsibility. All employees must sign an acknowledgement form confirming they have completed HIPAA training and understand their responsibilities. If you have any questions or concerns about HIPAA compliance, please contact the compliance officer at A New Horizon. Thank you for your commitment to privacy and ethical care.